We have some East Coast representation.
Hello, everyone.
Hello, welcome. We're gonna start in just 1 minute. We're giving people just a few more seconds to join us.
Yes, and thank you, everyone. And
Okay, so I think we will get started. Thank you for being here. I'll just get started with a few housekeeping notes. So again, welcome. I really appreciate you being here. As you may have noticed, this event is being recorded, and we will share the recording with attendees after the event. So please keep yourself muted, at least for the beginning portion of this webinar. We have about 1 hour, and most of our time here is going to be for your questions and for open discussion with a short presentation in the beginning. And this is a community event, so we do want to hear you. Please utilize the chat, ask questions, and connect with one another. And also at the very end, we will have open questions time for you to unmute and speak up a little bit more. And with that, I'm going to kick it off to Sara to give an introduction about herself and take it from here.
Hi, everyone. My name is Sara Pardej. I'm a postdoctoral fellow here at Stanford University School of Medicine in the Bridge Lab. So just a quick background about myself and kind of my trajectory. So my background is in clinical psychology. So I got my PhD in clinical psychology from the University of Wisconsin-Milwaukee. My clinical background is really focused in on neuropsychology, especially pediatric neuropsychology, as well as some adult experience in there as well. Research-wise, I've been involved in NF1 research since the beginning of grad school now. So I worked on several different studies as a graduate student looking at neuropsychological development of youth with NF1, as well as looking at EEG profiles and how they differ between kids with NF1 versus kids with ADHD who don't have NF1 versus kids who don't have either of those conditions. And I also worked on some intervention implementation, particularly of a social skills intervention for teens with NF1 that I'll be talking about today. My doctoral internship in clinical psychology was at Penn State Health, where I furthered my knowledge and expertise regarding neuropsychology across the lifespan. And now I'm here. And so I work in the Bridge Lab. We can go ahead and go to the next slide. So in the Bridge Lab, we work with individuals with RASopathies. And so in particular, we focus on neurofibromatosis type 1, NF1, and Noonan Syndrome. So my work is really expanded into both of those conditions now as well. And really in our work, we focus on kind of the delineating what does functioning look like, as well as the neuroimaging piece and the genetics piece and how that all runs together. So happy to chat about that further. And before we dive into the actual content, we wanted to just kind of let you all know that we are recruiting for some research studies. So if you're interested, we have some remote only. So those are via Zoom. And there's a couple of in-person research studies as well. So for in-person, we're looking for individuals with an SML, RAF1, or SOS1 mutations and then we also have a remote only, so a Zoom research study for individuals with the PTPN11 mutation, as well as a new research study about teens with NF1, because we know very, very little, unfortunately, about what it's like to be a teen with NF1 and any unique difficulties that may arise during that time period. So yeah, there's links up there and the QR code if you're interested, and we can answer questions about that at the end as well if folks are interested. But in terms of the agenda for today, again, very quick presentation just to kind of contextualize adolescence, and then also talk about just what we know from the neurodevelopmental literature about adolescence. And the majority of what we'll be doing today is I'm going to talk through some pre-submitted questions and then leave about 10 minutes at the end for a broader Q&A session. But again, feel free to use that chat, and Naomi is going to be keeping an eye on that, so we can come back to those questions. So first, I kind of want to get us all thinking about adolescence. We've all were adolescents at some points in our lives. So I kind of want to take just a minute or so, and you can either reflect in the chat, or if you don't feel comfortable, reflect just on your own to think about when you were a teen. What were your priorities and what kinds of things were difficult for you, either academically or socially, cognitively, interpersonally? What were the things that you were thinking a lot about when you were a teenager? Let's take a minute. I'm seeing friendships, sports. Yep, friendships fitting in, absolutely. I know that that was important to me too as a teenager. Fitting in, body image, absolutely. Yeah. All right. So let's go ahead and go to the next slide. So when we think about adolescence, it's a very unique time period. So it's actually the second fastest and second most extensive developmental period of growth. It's only second to infancy. So there's a lot happening. So you may remember back to when you were a teenager, all the hormonal changes, the body changes, the changes in the way that you think, the changes in the way that you relate to people. All of that is happening. And so along with that, there's also kind of this societal and social piece, in terms of expectations of development, of building independence. And we also see that during adolescence, there's a shift from valuing family opinions to valuing peer opinions. So there's a lot more wanting to spend time with peers, caring a lot more what other people think. And that really starts to take a hold in early adolescence and kind of persists, and deepens throughout the teenage years. So I'm going to talk about RASopathies kind of broadly. And I know RASopathies isn't something that is kind of used as a term in the general public. So just to clear up what that means. So RASopathies is an umbrella term for many different conditions, that are affected on the RAS-MAPK pathway. So like I mentioned in our lab, we specifically focus on NF1 and Noonan syndrome, which are the two most common, but there are other RASopathies as well, like CFC, NF2, schwannomatosis. Those are more rare, and unfortunately, there's even less research on those conditions. But we see a lot of similar areas of difficulty in terms of things like difficulties with learning, difficulties with social skills, attention. So you can see here we have just these kind of infographic sheets about the kinds of symptoms, both medical and cognitive, that can come along with RASopathies. And you can see some of them are similar. And the ones with the arrows are the ones that I'm going to be focusing about because of the nature of my training and what we study in our lab. So things like learning disabilities, attention, psychosocial functioning, and whatnot.
Children's missing books.
So
Just whatever's out there.
oh,
I don't know.
So if you can mute yourself, I'm gonna try to find you. Okay, I think we're good.
Sorry, that's not my business.
okay. So in terms of adolescence and RASopathies, so very little is known about adolescence and RASopathies. There's very, very few studies that focus on the adolescent period, which is why we're trying to build upon that literature. Because of those things that I mentioned, adolescence, so much is changing, both in when we think about brain development, in terms of hormonal functioning, in terms of cognitive development, social development. And so there's a lot of unique unique experiences to this time period. What we do know is that some of the difficulties that we see in the childhood period are likely to also continue on into the adolescent period. So things like difficulties with visual spatial reasoning or executive functioning, which is an umbrella term that covers things like organization, holding information in your mind, monitoring your own behaviors, inhibiting your impulses, those kinds of things. And unfortunately, we don't actually know about the trajectory over time. So whether teens with RASopathies catch up to their unaffected peers, or whether the gap widens over time, or if it remains the same. So unfortunately, we can't speak to that at this time. But what we can look to is the neurodevelopmental literature to at least hypothesize about what could be happening. So when I say neurodevelopmental conditions, those are conditions like ADHD, autism, learning disabilities. As we know, those diagnoses have a higher prevalence rate in RASopathies. So some of your kiddos may also have those diagnoses, or maybe they don't, but they still have difficulties with things like social functioning or attention functioning. But in general, what we know about kids with ADHD and kids with autism and kids with learning disabilities is that they are at increased risk of making impulsive decisions, making risky decisions, and difficulties sleeping, and difficulties in their social abilities. As social demands increase in adolescence, there's more burden put on the individual to interpret sometimes complex situations, and that can be tricky for a lot of kids with neurodevelopmental conditions. And some of this, oh, sorry, can you go back? And some of this goes into kind of the reward processing circuits that are in the brain. So especially when it comes to ADHD, there's a different sensitivity to processing rewards and risks. And when I say risky behaviors, I don't just mean things like substance use, which is, I think, what kind of usually comes to mind. I also mean things like overeating or choosing to stay up late at night, those kinds of things as well. But I do want to give a caveat as well that risky choices and risky behaviors aren't always a bad thing. So for example, looking at individuals with ADHD, for example, they're much more willing to take the risk to try a new hobby or go up to someone and start a new conversation or maybe ask someone on a date. So risk doesn't always mean a bad thing. It's just that you kind of have to figure out when there's potential danger involved or not. And we're going to talk about that a little bit and how to help navigate. But sleep is also a really, really important thing. As you may have experienced as a teenager, sleep patterns kind of shift over time in adolescence. So we find that in adolescence, there's a natural change that occurs in the brain that pushes your natural kind of sleepiness feeling time to later in the night and wanting to wake up later in the day. That is completely normal. And in a resource list that we're going to distribute, there's a lot of information about why that happens and what you can do about it, and language for what to submit to school districts and things like that if your student or if your child still has a really early start time in school, like some high schools start at like 7:30 in the morning. There's actually a lot of evidence to suggest that that impacts school performance negatively and things like that. But we'll talk about sleep also a little bit later. But we can go ahead and move on to the pre-submitted questions. So let's go ahead and start with the first one.
Okay, so thank you all for submitting questions ahead of time. We got some really, really good ones, and we're not going to cover all of them, but we're going to try to touch on most of them. So the first one that we're going to ask Sarah is, what strategies can I use to foster independence and self-advocacy when it comes to my child managing their own medical care?
Yeah, so this is a wonderful question, and I think it shows a lot of insight and care on the behalf of the parent. And I love to hear this. It's so, so important to make sure that you're building these independent skills in your kiddo. So I think about this in kind of two levels. So the individual level and the community level. So when we think about the individual level, it's really about starting to have your child begin to ask more questions and think about their own care. And so if your child has an IEP, for example, bringing your child to their IEP meeting. That's actually something that's really, really encouraged as soon as the child is like late middle school and certainly in high school to start attending those meetings so that they're part of the decision-making process when it comes to their education. And so, I know that teenagers don't necessarily want to do those things, but setting it up in a way where you encourage them to ask at least, two questions, for example, so that they can at least kind of get over the initial barrier of speaking up in a setting like that because it is really intimidating, and just building up their confidence in that way. Similarly, starting to have them participate more and more in their doctor's appointments. Often what happens in youth with any chronic medical conditions is that parents, because understandably of the stress of all, managing a bunch of appointments or a bunch of medications and whatnot, they tend to kind of take over. And maybe you've had the experience where the doctor asks your child a question, and what does your child do? They look to you, even though the doctor is directly asking a question to them. And so instead of answering for them, encouraging them to answer the question, as long as, it's within the realm of something you think that they can, answer. And if it's not something you think that they can answer, that's a great opportunity after the doctor's appointment to give them that information, so that next time if that's asked, they can actually come prepared with that information. And so again, asking them to ask a couple of questions at their next doctor's appointment. Instead of having them walk away when it comes to scheduling the next appointment, having them be involved, pulling out a calendar, start teaching them those kind of appointment building skills, because that's something that even though people generally pick that up over time, for some kids, it needs to be direct instruction. And so showing them how you do it can really benefit them. Same thing with like medication management. Next time they need a refill on something, have them be involved in that phone call so that they know what that's like. And really this, when I talk about adolescence, we're talking like 12 years old all the way up to like 19, 20 years old. So I'm not necessarily saying to do all these things when a kid is 12 years old. And there's no perfect start time. You know your teen best. And so building these things slowly, introducing these things along that adolescent continuum is going to be important. Money management is another really important concept. So starting to introduce the concept of bills to them. That is something that isn't necessarily taught in schools. And maybe it is, maybe that's something you can include in an IEP, and I think is a really great idea, but starting to have conversations with them about things like budgeting. And one of the best ways you can do that is having them have an allowance, especially when they're younger and if they can't have a job at that point. And so creating an allowance system where then they have to budget that, learning what savings do and learning a little bit about what interest is, starting all of that younger is going to only help them over time, because then they're going to have a frame of reference for later on when it's on them to have health insurance, to budget their income and understand and navigate all these complicated systems that we have for paying bills and health insurance and things like that. At the community level, if it's possible for your teen, I think getting a job is a really wonderful tool. And as a teenager, it's a much lower stakes, position to be in than having a job for the first time as an adult, when you actually are in charge of, making sure that you get your bills paid and rent paid and whatnot. So, I think it's important to first of all pick a job that will suit the interest of your teen. So maybe if they're really interested in animals, You can look at your local PetSmart or a pet supply store or something like that, something that they could gain some interest in. And maybe it's a summer job at first because balancing job and school is really hard at the same time. And if a job isn't feasible, which is totally understandable, volunteering is also a really great way to kind of teach those same skills. And when I mean skills is the interpersonal skills that come along with jobs. So dealing with complexities with coworkers, understanding the hierarchy of having a boss, having someone to report to, having responsibilities that you have to complete every day. All of those things are hard to teach at a conceptual level, talking to someone. It's really those kinds of skills that you learn experientially through doing those things. And remember that failure is a part of learning. I know no one wants to see their kid fail and make mistakes. That's a normal part of being a parent. But adolescence is a time to make mistakes. That's how we learn. I imagine everyone in the room right now can think to a pivotal moment in adolescence where they made a mistake and that kind of changed the course of how they saw themselves, what they did in the future. And that's really, really important, and it is normative. So let's go ahead to the next question.
Hey, thank you, Sarah. So, how can I boost my child's self-esteem and confidence during adolescence?
Yeah, this is a great question. So again, just kind of want to normalize that difficulties with self-esteem and confidence are a normative part of adolescence. So a lot of individuals struggle with that, but of course, some more than others. So we want to make sure that we figure out that nuance. In general, the kinds of things that can be really helpful are things like journaling, exercise, sleep, limiting social media. All of these things that we know are common sense come up time and time and time again as the most effective strategies for feeling better about oneself. And so I think some of those things can feel daunting, right? Like, when am I going to fit in exercise when I have school and then maybe an after school club? And so that's really up to working with your teen to figure out what, one, is something they would actually do, and two, at a actual manageable pace. And when I say exercise, I don't mean your teen needs to go run on the treadmill for 60 minutes and be preparing to run a marathon. Exercise can mean going on a walk to a nice, through a nice nature preserve, accessible to you. It can mean doing some stretching. It can mean, just doing some meaningful rolls with your arms. Anything that's meaningful movement that kind of removes your teen from the kind of negative headspace of whatever they're thinking about at that moment to focus on something else can be really helpful. Exercise also will help increase sleepiness and tiredness, so that it hits in both ways. So, try and think about that. The other thing that's really helpful is increasing participation in hobbies and preferred activities. So engaging in hobbies or different clubs or sports that are meaningful to your teen will help building their feelings of self-efficacy. So their feelings of, I can do this, and having something that they can turn to that boosts, that dopamine, makes them feel better, but also gives them a sense of accomplishment is really, really important. And it's even better if you can find a hobby where they can engage with other people. Because again, remember, in adolescence, teens find more fulfillment from peers than they do from family. So if you can find a club, like let's say anime is a very popular one, if you can find a club, maybe at the library, maybe at school, where they can talk about anime with other teens, that's going to feel really fulfilling with them and boost their mood and boost their self-esteem as well. And they can find other people that are like, wow, they think like me. Wow, they also think XYZ show is really cool. Oh my gosh, they complimented my shirt that has, that show that feels really good to me. That all helps that reward circuit. The last thing that I wanted to note with this one is modeling. So even if you think your teens aren't paying attention to you, they are. They're always watching, they're always listening. And so the next time that you do something that maybe you don't feel great about, or maybe you're not feeling great yourself, you can use that to your advantage as a learning moment. Maybe bring it up at dinner, maybe bring it up when they're in earshot, talking to another family member about why you don't feel great and what you're going to do about it to cope. Because they are listening, and if they see, wow, my parent felt down on themselves because they gave a presentation at work today and it did not go well. And, they went on a walk and they felt much better. Maybe I could consider that for next time as well. They are watching, and people mimic what they see their parental figures doing. Maybe not now, but later in life, certainly.
Thank you. Excellent, excellent tips. And let's go to the next question. How do you support a teenager with all the changes of puberty, driving, dating, getting a job, when all their peers are able to do that easily, but your kid may not, or it may look differently?
Yeah. Sorry, I don't know how I just got muted. The first thing that I think is important to remember with this one is that it actually doesn't come easily to most people. The big difference is that for individuals who are neurotypical, don't have any other diagnoses going on, they're much better at hiding that they're anxious or nervous in these situations, because these are anxiety-inducing situations. Thinking about in the chat earlier, a lot of you were saying that you were concerned about your friendships or things that you had going on. I know certainly I was worried about getting my driver's license or getting rejected to go to homecoming or whatever. There are normal and healthy levels of anxiety that come along with these things. But again, we want to make sure that we're monitoring and supporting when maybe the anxiety with those things is a little bit too high. So one big takeaway I hope that you come away with is to help manage expectations, and that there's no script for how things are supposed to go. Like, there's no written rule that you need to get your driver's license on the first day that you turn 16. And in fact, having a pressure like that can increase anxiety to the point where it's no longer going to benefit performance. And that it's okay if your teen doesn't go to homecoming, or maybe goes with friends instead of with a date. Everyone's kind of on their own path with these things. And again, utilize the fact that there's that shift to peer importance over family importance. So even if they're not maybe talking to you about getting rejected for homecoming, for example, maybe hopefully they're talking to a friend. And if you notice that they're feeling down about themselves about something like that, encouraging using social facility or socialization for coping. So encouraging them to call a friend over, or have, a sleepover, or talk on the phone, and give them that space to process if they don't necessarily feel comfortable talking with a parent about these things at this point, making sure that they're talking to someone at this point about those things. And it can also be really overwhelming thinking about doing all of those things at once. Like, okay, I'm going through puberty, and I need to start driving, and I need to start dating, and I need to get a job. Like that, I can't do that all like this month. That's way too much. And so coming up with a plan about what are my goals for doing these things. So maybe the goal is I want to be able to drive before I graduate high school. Great. Okay. So let's work backwards from there. What do I need first? Okay, I need my permit. And then working out exactly, here are the steps that are involved in getting a permit. And once you have that, okay, so getting a driver's license is kind of a vague goal. What do I actually need to accomplish that? I need a certain amount of hours. Okay, so let's start off with I'm going to drive 30 minutes every week. And so now it's on both you and your teen to hold them accountable to being able to do those things. And you can use rewards, a reward system to your benefit as well with that. And I'll extrapolate a little bit about reward systems in a coming slide. The last thing that I want to touch base on is that for some teens, these things don't come naturally. And it can be a big struggle to just understand what is expected in those situations. And at that point, what I would recommend is considering something like a social skills intervention training program. So I mentioned earlier, we can go to the next slide. I was part of an implementation study for adapting a social skills treatment program that was developed for teens with autism. It was also validated for teens with ADHD. And really what this is called PEERS, but there are many other social skills intervention training programs. What it does is it teaches social skills in a very tangible way, breaking down the nuances of what's expected in a back and forth conversation or how to arrange a get together. If those are the kinds of things that don't come naturally to your teen, that you feel like you have to explain, maybe you should consider something like this. And you don't necessarily have to do this in you don't necessarily have to find like a psychologist to do this. Interventions like PEERS are actually developed to also be able to be done at school. So if you have an IEP meeting coming up, you can bring up a program like this. Speech language pathologists are qualified providers for this, and educational psychologists are also qualified for providers for things like this. And in our resource list, we have links to find providers for PEERS in particular, but again, there are other social skills interventions you could explore as options as well. All right, we can go ahead to the next one.
And the next question is, how do you navigate these teenage years when they obviously look different than able-bodied teenagers?
So I want to start off by saying that, in a perfect world, everyone would be nice to each other, right? But that's unfortunately not the reality that we live in. Teenagers can be cruel to each other. I hope that none of your teens have to go through that, but bullying does happen. I've noticed just in working with, again, with the, NF1 population in particular, that in tight-knit communities, like smaller communities, this tends to be less of an issue because people kind of grow up together and get to know each other better. And I often found that this was an issue for teens who were kind of in really large schools where there were maybe a small fish in a big pond. And there were, the rumor mill tended to go on and things like that. So I think in this context, it's going to be really important as a parent to help your teen figure out context. So if someone asks a question or makes a comment, is it coming from a state of curiosity and genuine wondering, or is it coming from a malicious place? And now we know that people necessarily aren't always great with their words, and sometimes people can have, that curious intention, but maybe their question comes off in a rude way. And so that kind of nuance can be really helpful to kind of practice and think about with your teen. So my answer is different for those two different situations. So if the question is coming from an error, like I'm gonna go with the, thinking about somebody like making a comment as an example here. So if someone makes a comment about your teen's appearance, for example, if it seems like they're coming from a place of curiosity, like what are those bumps on your skin? I wish people didn't comment on people's bodies and appearance, but the reality is that it does happen. it's important to kind of have a script ready to go for your teen for how to respond in those situations. And that script may change over time. We find that individuals with chronic medical conditions, at some points, they feel like they really want to be advocates for their condition and educators to others, and they really want to share a lot about their experiences. And sometimes they're feeling kind of burnt out and like they don't really want to talk about it. And both of those are okay. It really just depends on what the boundaries are for that person at that time. And so having a go-to phrase like, oh, I have a condition called NF1, it's genetic, and these do hurt me or they don't hurt me, whatever is true for them. And just a quick response. And if they want to come up with something to elaborate more, great, they're welcome to, but they also don't owe the person a response. So again, whatever feels right for them, just make sure that it's something that they practice in non-anxiety provoking conditions, because the more you practice it when you're not anxious, the more instinctual it will be when you are in that kind of anxiety inducing situation.
Have you long jump?
Haven't done it.
Now, if this is coming from a malicious place where it's clearly a tease, or something meant to try and arouse negative emotions out of your child, that's a different situation. In those situations, the main goal of the teaser is to get a negative reaction out of your teen. And so even though it's really, really difficult, the most important thing to do is to not give them that reaction and completely play it off as if it does not matter to them, because you take the power away from that person. So saying something like, was that supposed to be funny? Okay, and all right, kind of belittling what they said, taking that power away from them. If your teen has a pattern with this person where the person already knows they can get a reaction out of your teen, it's going to be a little while of using those kind of belittling phrases until the bullier realizes they're no longer going to get that reaction. But generally, we find that this works really, really well, because what's going to happen is when that person realizes they're not going to get a reaction out of your teen, they're going to move on to the next person. Basically, don't feed the trolls is what it comes down to.
Okay, and moving on to the next question. Can you discuss how delayed bone growth might impact neuropsychological development in adolescents with RASopathies? And then also, are there any strategies or supports that can help prevent or address potential neuropsychological issues that are specifically stemming from delayed bone growth in adolescents? What steps can be taken to support their development?
Yeah. So to my knowledge, there's no causal link between bone growth and neuropsychological development. But as we discussed kind of more broadly, teens with RASopathies are at risk of things like difficulties with attention, with executive functioning, with learning, and social skills, as a result of their genetic condition and the downstream effects of that. And like I mentioned, unfortunately, we don't have the data to be able to predict like if teens with RASopathies can catch up or not. But what we do know is that these processes can be scaffolded. And so what I mean by that is using strategies to help build those skills. So starting off with high support and then taking the support away as your teen continues to progress and meet those goals. One important thing that I think is often slept on in the adolescent years is reward systems. And so in the resources list, there's going to be a playlist to videos by Dr. Russell Barkley, who's kind of like really this fantastic wealth of resources when it comes to parent management training for individuals with ADHD kind of more broadly. But what's really important is an effective reward system. Like I mentioned at the beginning, individuals who have ADHD or just difficulties with attention in general are really sensitive to rewards and gratification. And so you can use that to your benefit. Now, rewards for a teenager don't look the same as for a kid. So, stickers, they're not going to work the same way for your 14-year-old as they may have when they were 5. But the important thing to have is short, medium, and long-term rewards. So a short-term reward is something that's daily. A medium-term reward is something that's weekly. And a long-term reward is kind of variable, but at least at the most monthly. So what does this mean? In terms of short-term rewards, things that your teen is already earning, just in general, now they have to work for. So let's say that you're really struggling with your teen finishing their homework on time. It's really hard for them to kind of come home, sit down, and get to work on their homework. And they kind of have access to their PlayStation as much as they want to. Now they have to work for that time with the PlayStation. They can't play on their PlayStation until the homework is done and it's verified that it's done. There's growing pains with this. I know some of you are sitting there thinking like, oh, I'm going to get a tantrum. It's not going to work. There's actually a word for that. It's called an extinction burst. That's actually what we expect to happen. Once they're going to increase that kind of negative behavior, and then it'll sharply decrease. You just have to like cope yourself and be willing to put up with the tantrum, and make sure you have those coping skills as well and are prepared for that extinction burst. So let's stick with the homework example. You want to build kind of reducing their impulsivity, and make sure that they can monitor, make sure that they can do their homework on time. So that's your short-term reward. Every day, if they can complete their homework, then they get to have their PlayStation time. Medium-term reward. So you have to decide, and with a teenager, this is negotiable. They have to be at the negotiating table with you for what is reasonable for them. Let's say you decide with your teen that it's a good starting point that if they are able to meet that short-term reward 3 out of the 5 days of the week, then they get their weekly reward. And this should be variable. So like, let's say one week it's that they get to pick where you go out for dinner Saturday night or where you order from. Maybe it's that they get to pick the family night movie or family night game. You really want to switch up what it is because teens can habituate to the reward. And if it's the same thing over and over again, it's no longer going to be rewarding. But again, they should be part of deciding what the reward is. And it should be a medium reward, right? So not like new pair of shoes. That should be something that could be a longer term reward. So what I recommend for longer term rewards, you can either use a calendar or jars can be really effective. So let's say use jar with a marble. So every day they finish their homework, on time, they put a marble in a jar. You're walking through the store one day and they go, I really want that new pair of shoes. Great, that's going to cost you half of a jar. And once they get half of the jar, they get to redeem that new pair of shoes. Let's say you have a trip to Disney World coming up and they're really begging you for that flash pass. Great, you can have that flash pass. You just have to fill up the jar. And, just make sure that you are using your own judgment for what is, what each marble is like worth and making sure that it's not like working too hard or too little. So that's going to take a little bit of fine tuning along the way. That's the basic gist of those reward systems. And remember that the teen has to be involved in choosing what the rewards are.
Thank you. And we'll move on to the next question. And I think we're almost through with the pre-submitted questions, and then we will stop the recording and open it up to any questions you may have live. Can you talk about how Noonan syndrome affects communication? My daughter is 19 and struggles with social communication in college now and is having trouble with sustaining back and forth conversations.
Mhm. Yeah, so difficulties with language are common for both individuals with Noonan syndrome and NF1. So your daughter is not alone. So like we discussed earlier, there's a higher rate of autism in RASopathies than in the general population, but there's a lot of individuals with RASopathies who struggle with social skills that don't actually neatly fit the criteria for autism. And back and forth conversations in particular are a common area of difficulty. And that's because they can stem from a few different things. So if your teen struggles with executive function, attention, or impulse control, then having a back and forth conversation is really challenging. Like, think about it. When you're having a back and forth conversation, you have to listen and focus to what the other person is saying. You have to hold that in mind while you're thinking of your response. And then you have to reciprocate in a way that engages the other person and watch for how they're responding to you via both their verbals and their nonverbals. So if you have problems with attention, that's a lot to be attending to. And so if attention is part of the problem for that back and forth conversation, it's going to be important to actually treat the symptoms of attention. So whether that means medication or behavioral therapy or a combination of both of those things, and also kind of cueing them in when you notice they're not actually paying attention so that they're starting to notice this about themselves in a gentle way, and not an accusatory way, but kind of in a gentle way, like, did you hear what I was saying? Like, I'm wondering if you heard what I said, and, kind of work from there. If the difficulty stems from a lack of knowledge about how to actually do these things, then those kind of group social skills intervention, like I mentioned earlier, would be a much better fit. And that's often a really core skill that they focus on very early in these kind of social skills interventions. So they'll literally break down, like, kind of step by step, what do you do in a back and forth conversation, what's expected of you, what to watch for, and then role playing with the other members of the group and with behavioral coaches, so that they can get a feel for, after learning about these things, how back and forth conversations generally go. Also, just try and keep in mind that, even if they're not having back and forth conversations with you as a parent, they may be having back and forth conversations with their friend. So kind of, maybe next time they have someone over, kind of tune into whether they are actually doing it, just maybe they're not in the mood to be doing it with you at that moment. We can go ahead to the next one.
Okay. And the next one is, how can I explain to my 11-year-old son with PTPN11 Noonan syndrome that he has a syndrome? So far, he hasn't identified himself as different from his peers, except for the fact that he uses growth hormone treatment. When and how should he find out about his diagnosis?
Yeah. So in my experience, a lot of the discomfort in these situations comes from the end of the parent and their anxiety about making their child feel different from others. And the reality is that often kids and teens are a lot more tuned into what's going on around them than we give them credit for. Like, he may have noticed that he has more doctor's appointments or has more trouble focusing or some other aspect of Noonan besides growth hormone treatment. And so I think that this is always a great inflection point for the parent and any other caregiver involved to reflect on, what's the worst that could happen? There is a chance that your son could briefly feel different from others when you tell him that. But again, he probably has or will very soon anyways. And especially, think about teenagers. They always think that they're different from everyone else, regardless of whether they have Noonan syndrome. It's called the imaginary audience. They think everyone's watching them and that they're different. So, just think about how enlightening it could be for your son to understand that there's a name for why he may be taking extra medications or may be struggling with learning or social skills or attention or whatever may be the case for him. In my experience, for the majority of people, both kids and adults, with pretty much any diagnosis, it's relieving to know that there's this name that explains a part of themselves that they can also use to help explain to other people. And I also want to note that this is where it's important for you as a parent to have community. Caregivers spend so much of their time focusing on the needs of the people that they care for that they often forget to take a moment to focus on and care for themselves as well, and thinking about carrying this kind of um, this hardship and carrying that burden of that diagnosis all by yourself, thinking about that. And is this the right moment? Is that the right moment? That's a lot to carry and to be thinking about all the time. And so, if you can find other parents and convene with them and think about how they talked about it and what went well and what they wish went differently, hopefully that relieves some of that stress for you. In terms of the how can I explain part, you know your kid best and their level of maturity and understanding, but my baseline recommendation is to choose a time and a place that you know that they're generally calm and comfortable and that you are generally calm and comfortable. So bedroom tends to be whoever's bedroom that is, that's their spot. So bedrooms usually aren't a great place. Picking a third space location, like maybe a park or, a cafe or something. And then also use fact-based language. So things like you have a genetic syndrome called Noonan syndrome instead of, kind of putting emotion-based language or your own thoughts and opinions about it. And ask for their understanding along the way. So, do you know what genetic means? And making sure that they're comprehending what you're saying along the way. And while you're listening, while you're listening to them, whatever facts you want to give to them, make sure that they know that with any RASopathy, it varies a lot from person to person, in terms of what's easier or harder for them, and that they're still, going to have their unique experiences. And make sure that they know that they can ask you questions, and that if you can't answer the question, affirm how great of a question that is and encourage them to ask that at their next doctor appointment and help them build those self-advocacy skills and independence skills.
Thank you. And our next question is, my daughter is in middle school, but seems to feel more comfortable interacting with children who are 2 or 3 years younger than she is. I think likely due to sociocognitive and physical developmental delays. What are some ways to support her in navigating middle school? And are there any ways to help her develop and become aware of the social skills that she will need to function later in life?
Yeah. So this is very common for individuals who struggle with social skills. It's very common in autism, and I'm not saying that your child has autism per se, but in the autism world, for a long time, the mantra was to push these kids into their same age peer groups. And as you might imagine, that actually kind of had mixed results. For some kids, they made that transition just fine, but for others, it was really isolating. And that's because what we found is the key ingredient in friendship is not age, it's common interests, and that's across the lifespan. So my guess is that your daughter is veering towards younger children because they may have the same interests or similar interests. And that's actually really adaptive. She's following her inner cues to seek out the kinds of people that she's gonna have things to do with, gonna have things to talk about. So that's not necessarily a bad thing itself. However, where this might be a challenge is when she reaches those academic junctures, like you mentioned with middle school, where she'll be kind of physically split off from them during the school year or during the school day, at least for a couple of years, and then have to do it again in high school. And given that teens spend so much of their time in school, it can be helpful to find social support at school. So what I recommend is making sure that she's involved in clubs or activities where she finds her people. So middle school is typically where we start seeing, clubs pop up that she could sign up for, and make sure that she's finding one that interests her. And then she'll be in an environment where she has common ground with her peers, and she's probably going to find other people like her who have those same interests. And if for some reason your school doesn't offer clubs, libraries are also a wonderful place to find that community. And I'm always surprised to find out like the very diverse clubs that libraries have to offer. So yeah, definitely don't sleep on that. But I can sense from the underlying thread of this question that a main concern is that her daughter's not catching up with her peers. So unfortunately, we again don't have that data, but it could be the case that if she's been consistently 2 to 3 years behind socially, that she could continue that way. But there's always going to be people who are 2 to 3 years younger than her. And so again, it's more important that she's finding people who have those similar interests with her. I think my main concern for your daughter is not necessarily that socializing piece. It's to make sure that she's learning those safety related social skills. So this is an important topic that I just want to spend a little bit of time on because it's often really overlooked in these kinds of conversations because it can be uncomfortable. So in adolescence, it's very important to have honest and developmentally appropriate conversations about adult topics like money, like sex safety, and substance use. And so, right, this is totally separate from friendships, but make sure that you're having conversations about safety online, safety with strangers, and to make sure that your child knows how to identify when they're being taken advantage of. And, having these conversations again in a fact-based way, not out of fear, not out of anxiety, but just based on facts. Your teen probably has questions about these topics, and if you don't answer them, one of their more uninformed peers probably will. So it's important that you are kind of bearing the brunt of that conversation, even though it's uncomfortable. And in our guide or our webinar resource list, there are resources online that you can look at to kind of help you find language that you feel comfortable with. And also remember that these conversations should be returned to multiple times because what's relevant for a 13-year-old is different from a 16-year-old to an 18-year-old. So it's something that you should be revisiting over time with them. But I do want to finish on a positive note. So I know it can feel frustrating to see that your teen is 2 to 3 years behind their peers. But I want you to know that, these teens still can thrive. It doesn't preclude anyone from thriving that they're hanging out with people younger than them. Yes, we see that, having this kind of profile, sure, maybe they're a little bit socially immature, but as they grow up, these are the exact kind of adults that tend to be more creative, work better with children, and retain that sense of curiosity and wonder about the world. And I think we can all agree those are wonderful, wonderful qualities to carry into adulthood. So I know we're running short on time, but the next slide, just very quickly, some general recommendations, and these are all in the list of resources, but for risky behavior, things like mindfulness and if needed, acceptance and commitment therapy, which embeds mindfulness into the practice, can be really helpful. For sleep, reducing caffeine, that means soda, tea, energy drinks, all those kinds of things. Reducing technology use, especially 2 hours before bed, and just having better sleep hygiene practices is important. For schools, know your rights as a parent and make sure your child is learning their rights for self-advocacy and using accommodations to your benefit. Technologies can be really life-changing accommodations at school. For social skills, enrolling in those activities and social skills groups is needed. For attention and executive functioning, helping scaffold skills, modeling those skills, and potentially managing using therapies as needed. And for independence, make sure you're encouraging questions, giving them responsibilities, and embracing those teaching moments. I'm happy to stay on an additional 10 minutes because I know I ate into that time. So we can go ahead and jump
Yeah,
in.
thank you. I want to make sure that we are mindful of time, but maybe we'll take one or two questions that came up during. Before we do that, I just want to kind of close the recording portion of it. So anyone who's watching this on demand, all the resources that we've mentioned will be in the YouTube description. And now we are going to kind of pause the recording.